Surgical abortions have been front and center in the Roe v. Wade debates for decades, but the data shows more women are using abortion pills these days. More than half who are 8 weeks pregnant or earlier choose medication abortions, according to the Kaiser Family Foundation. Interest in abortion pills has spiked. Researchers at UC San Diego and Bryn Mawr tracked Google searches. In the 3 days following that Supreme Court leak back in May, searches for medication abortion jumped 162%. One doctor recently told me these pills are quite safe.
We actually know that these medications are extremely safe. They are actually safer than Tylenol. So just let that sit in your head and wrap your head around that for a moment. You can get that over the counter. The side effects and the chance if you were to overdose on Tylenol is way worse than if you were to somehow incorrectly use these medication abortion pills.
It's a big claim, so we did some digging to find out, are these abortion pills as safe as others, if not safer, that we keep at home? Newsy national investigative correspondent Patrick Terpstra found out.
The abortion pill has a long and complicated history that begins in the 1980s. First developed as RU-486 in France.
RU-486 is a death pill designed to kill unborn babies.
This drug is highly safe and effective.
Dr. Beverly Winnicott fought to bring the abortion pill to the U.S.
This is a revolutionary technology that women could take a pill and have an abortion. Think about that. You don't need a sterilization of a hypodermic needle. You don't need a surgeon. You don't need any kind of anesthesia.
That's what happened. In the 90s, the politics surrounding abortion turned violent. Clinics were bombed, providers were killed, and the FDA felt pressure.
There were a lot of expectations, but there was an immediate knowledge that everyone who touched this drug was afraid.
In 2000, the FDA announced the abortion pill would go to market under the brand name Mifepristone. Here's how it works. Mifepristone, or a generic version, is the first drug taken to begin a medication abortion by blocking progesterone, a hormone to maintain a pregnancy. A second drug then expels the pregnancy, completing the abortion. Mifepristone was heavily regulated, unavailable at pharmacies because the FDA wanted to monitor its safety. The FDA has years of evidence showing the abortion pill is effective and safe. According to FDA data, as of 2018, there were 24 deaths associated with the abortion pill. But when we look deeper, we found nearly half of the deaths appeared to be related to other things: homicide, suicide, drug abuse, emphysema. And even the FDA says that none of the 24 deaths could be causally attributed to the abortion pill. So there was no direct link between taking the pill and dying. 24 deaths mean for every 1 million patients, 6.5 died.
It's a procedure like any other procedure that has complications at a known rate, and the complications can be very serious, and sometimes they can kill women. And I think to say anything less is to be dishonest with women.
6.5 deaths per 1 million patients is a better safety record than penicillin, according to some studies. But despite the abortion pill's record, for opponents, there's only one way to make medication abortion safe.
Not doing it. Not doing a medication abortion would make it safe, because it's certainly not safe for the unborn child, and it has real risks for the mom.
We decided to compare the death rate for the abortion pill to the death rate for erectile dysfunction drugs, another drug given to relatively healthy people that also deals with reproductive health. One study found the mortality rate for erectile dysfunction drugs is about 4 times higher than that for Mifepristone. In December, the FDA relaxed restrictions on the abortion pill, also known as Mifepristone, allowing certified pharmacies to mail the pill to patients in their homes, expanding access to medication abortion in many states. Access Attorney General Merrick Garland defended after the Supreme Court overturned Roe v. Wade. He said the FDA has approved the use of medication Mifepristone. States may not ban Mifepristone, citing the FDA's expert judgment about its safety and efficacy. While the abortion pill could be a way around new restrictions, it also raises new legal questions about access to abortion. Patrick Terpstra, Newsy, Washington.